What would you do if one day you're at your doctor's office, he sits you down, says, I'm sorry, but you have rheumatoid arthritis. Today, we're going to follow Sarah's journey. She's a 35-year-old graphic designer, mom of two, single mom, and she was recently diagnosed with rheumatoid arthritis. We're going to follow her journey, and in so doing, we're going to understand the different treatment options for rheumatoid arthritis. So here we have Sarah, and just living her life, and she notices one day that her joints, particularly her knuckles and her wrists, they're more tender, and they're changing. And, initially she thought it was just, she was overdoing it because, that happens. But then with time, she noticed that she was becoming stiffer and stiffer, and it was worse in the morning, and typically this would last at least an hour, and this was progressing. Then she started noticing some swelling involving those wrists, and they were a little hotter than usual, and they would swell for a few days, and then they would get a little bit better, but with time it became more and more persistent. And then she noticed, after about a month or two, that it seemed to be traveling. So she was experiencing similar symptoms involving her feet, to the point where she was having more difficulty walking because of those symptoms. And she was becoming more and more fatigued. And she couldn't really explain why, because nothing had really changed at that point. So she sees her doctor, and her doctor runs a few labs and finds that, her rheumatoid factor was quite elevated, and her markers of inflammation in her blood were also quite elevated. So her doctor refers her to a rheumatologist. And rheumatologist, does your history, her physical, and looks at her previous labs, runs a few more, and sits her down and says, I'm sorry, you have rheumatoid arthritis, and goes through the process of explaining to her what rheumatoid arthritis is. So rheumatoid arthritis is a type of autoimmune disease. And what we mean by that is it is a disease where your immune system has lost its sense of self, meaning that it has difficulty detecting your cells versus other cells. And so it's targeting its immune response to your own cells. So it causes quite a bit of swelling, causes stiffness, and if you don't really treat it in an appropriate and timely manner, it can actually cause permanent damage. So it's very important to get ahead of this. Now, rheumatoid arthritis typically affects smaller joints more so than larger joints, and it tends to do so in a symmetrical fashion. So your knuckles tend to be affected, your wrists, your feet, but it also can affect your knees as well as your shoulders. It's also important to note that rheumatoid arthritis is a systemic disease, meaning that other organs can be involved, not just your joints. So you can see rheumatoid arthritis affecting the lungs, causing fibrosis of the lung. It can also cause nodules to develop on the skin and sometimes inside the lungs. It can also affect your eye, your heart, although these are less common these days, as we do have effective treatment to control this condition. So let's get back to Sarah. So at this point, she's quite overwhelmed for very good reasons. Just wondering, how's she going to take care of herself? How's she going to take care of her kids? Will she be able to walk? Will she be able to work? So the first thing that Sarah does with her rheumatologist is establish goals. She needs to establish realistic goals. And these can be very different from person to person. It could be something like, I want to be able to walk 3 miles without any pain within the next 3 months. But everyone's really different. But it's important to establish that goal to see where do you need to be and establish benchmarks. The second thing that she does with her rheumatologist is discuss different medications. So generally speaking, we classify medications for rheumatoid arthritis as disease-modifying anti-rheumatic drugs. We'll call them DMARDs. And these are separated into conventional DMARDs, biologic DMARDs, and small synthetic DMARDs. Generally speaking, when someone is diagnosed with rheumatoid arthritis, we'll start with a conventional disease-modifying medication unless there is a really good reason or a contraindication to those types of medications. In terms of conventional DMARDs, these include things like methotrexate, leflunomide, sulfasalazine, and hydroxychloroquine. They can be used on their own or they can be used in combination. It really depends on what's going on. Now, at that point, it's very important to sit down with your rheumatologist to figure out which one is best for you and discuss, risks and benefits essentially. With respect to biologic medications, these are medications that either come as injections or infusions, and there's a lot of them. A lot of them you see on TV, on commercials. All of them are very different. So some examples include Enbrel, Humira, Actemra, Orencia, And then you have your synthetic small molecule DMARDs, and those are they come in pills. So that's like a class of medication that we call JAK inhibitors. So those include Rinvoq, Olumiant, and Xeljanz. So at that point in time, Sarah has a discussion with her rheumatologist. She discusses what her goals are, and she goes over risks and benefits of conventional medications. And ultimately, they decide, well, we're going to start treatment with methotrexate. So Sarah starts methotrexate. She takes 10 milligrams once a week, and she combines that with folic acid on a daily basis to help prevent potential side effects from happening. And so far, she's tolerating the medication well, maybe a little bit of nausea the day after her methotrexate, but each week it's getting a little bit better. But it takes a really long time for methotrexate to become effective. One day she wakes up and her hand is really swollen. It's very tender. She has difficulty making a fist. So she calls her rheumatologist and says, hey, I think I'm having a flare. And then her rheumatology calls back and says, yes, you are having a flare, and prescribes her something called prednisone. Now, prednisone is a steroid, and so she starts to take it, and it helps tremendously. She takes it over a 9-day period, and continues methotrexate at the same time. Now, it's important not to exclusively use prednisone when treating rheumatoid arthritis, because it's not a question of whether you'll have a side effect from prednisone, but rather a question of time. And these include things like weight gain, glaucoma, cataract formation, osteoporosis, and increased risk of infection. But it's very helpful to reduce the amount of inflammation when having a flare. There should just be a period where you're starting the medication, and you should have a plan to go off the medication. And generally speaking, you should taper off the medication. So Sarah finishes her prednisone taper, and she feels much better and continues with the methotrexate and folic acid, and intends on following up with her rheumatologist in approximately 6 weeks. So Sarah follows up with her rheumatologist, the 6-week appointment, and unfortunately she's still having quite a bit of joint pain, swelling, stiffness, a lot of debility. She can't exercise like she would like to. She hasn't achieved her goal yet. So they make a decision, well, we're going to increase the dose. So they increase it to 15 milligrams once a week, and they follow back again. She's tolerating it, but again, she's still having quite a bit of symptoms. So they increase it to 20 milligrams once a week. But again, it's not working. It's partially working, but it's not working to reach her target and her goals. So they have a discussion about biologic DMARDs. And the thing that's very different with these biologic DMARDs is that they're very targeted. They're synthesized, but they're blocking one specific protein or one specific cytokine. So they go over the different risks and benefits of all the different medications, and they ultimately decide, well, we're going to start treatment with Enbrel. Now, Enbrel is very different than methotrexate. It's a lot more targeted, and it also can increase the risk of certain infections, more so than methotrexate. So the medication is prescribed, and she receives the medication and receives training on how to self-inject appropriately. She gets a handle of it, and thankfully, after about 6 weeks, she starts to see that, her joints feel a lot better. They're less swollen, they're less tender, and she can actually do a lot more. She's now walking about 2 miles a day and feels pretty good. She also hasn't had any infections, thankfully, and her follow-up blood work looks great. So her kidneys look good, her liver looks good, and her white cell counts look very good as well. She's feeling pretty good about herself. She's feeling pretty optimistic about the future. So Sarah's really excited about her next follow-up appointment with her rheumatologist. She's feeling a lot better. She's not quite at her goal yet, but overall things are looking brighter and brighter, and she feels very optimistic about the whole thing. So she sits down with the rheumatologist and they start chatting, and they decide, we're going to continue with the current medications she's on, so the methotrexate, 20 milligrams a day, and the Enbrel and the folic acid, but they're going to focus on exercise. They're going to focus on diet. They're going to focus on stress management and getting better sleep, because sometimes medications are not the solution to everything. It's really, really important, especially with rheumatoid arthritis, to incorporate different health practices to help reduce inflammation. So she starts to implement a Mediterranean-style diet. She's walking more and more. Now she's gotten to that 3-mile mark, and she's starting to feel a lot better. She's starting to sleep a lot better, sleeping at the same time every day, waking up at the same time, and started doing some meditation. Even though rheumatoid arthritis is a lifelong condition, there is hope. There are multiple treatments, and there's a treatment for every single person. You just have to find it. So if you've been diagnosed with rheumatoid arthritis, I highly suggest that you speak with your rheumatologist and have these conversations. Discuss like what your goals are. Discuss your concerns about different medications. If you have any comments, questions, or any like ideas for any future videos, please leave it on the comment section. Thank you for watching.